All right, we are live. Welcome back to Money Plan Conversations. I'm Malika Daniels, and I'm a money coach with Women Who Money Plan. And I do these conversations once a month with somebody either in like a finance field or real estate field or something that can help out my clients when it comes to their finances and just making sure that they're in the best position possible. And this month, I'm so excited. I'm joined by Stephanie Diamond, who is the owner of Diamond Chick Consulting. Welcome, Stephanie.
Thank you so much. Glad to be
Yes.
here.
Well, I'm going to let Stephanie introduce herself. She can tell us a little bit about what she does, and then we'll get started.
All right. Well, again, thank you, Malika, for having me here today. I am Stephanie Diamond. I'm the chick with a plan. And what that means is that I help people purchase their health insurance. I work with mainly self-employed individuals who have never had to shop for health insurance on their own, and they need help in that world. I also work with business owners that are looking to provide benefits for their employees. So that's why I'm a chick with a plan. I can do it all, but my focus is really on those self-insured small business owners that just need some help in that insurance world.
Awesome. Thank you so much. All right. So let's dig a little bit about how did you get started in this industry?
Well, not at all thinking that this was ever something I was ever going to do, much less own an agency. That never showed up on any of my testing. But I came from a nonprofit world. I was a theater major in college. I was an art management minor, which kind of got me into the nonprofit world. Worked for a school for about 10 years. And then life changes happened. I needed to actually income was an issue. I needed to make more income. And unfortunately, I'd kind of capped out what I could do at a school. And this was an opportunity for me to build something that I had control over. I was able to, continue being a single mom, and I was able to have flexibility in my schedule. So this industry had a lot of appeal as far as me being able to make it what I wanted it to be.
Yeah.
But I've been doing this for 6 years now, and it's finally turned into the thing that I've wanted it to be. And I'm so excited to be here still doing this, but in a capacity that makes me feel good and allows me to give back as well.
That's awesome. And I
Yeah.
know you mentioned that you work with a lot of small business owners,
Mhm.
entrepreneurs. So if someone is thinking about switching into that industry or being an entrepreneur, but they have a full-time job, at what point should they contact you in terms of looking at healthcare benefits?
That's a huge concern. And that's a lot of my conversations start off that way. Actually, quite a few conversations start off that way, that they are thinking of leaving their current uh, role and starting something on their own, because that's just what we're doing in this world these days. And um, some people care less if they have insurance or not. If they've had it their whole life, they don't really understand what they had because they never went without it. Um, and it, that sticker shock can be a little much, but it can also some people have been so told or have been told that insurance is just the worst, that they realize it's not as bad as they thought. And this hurdle that they thought was keeping them from being able to go out on their own was not as big as they thought.
Mhm.
So it allows them to have some control over a world that we have very little control over these days.
Yeah.
And so when they're in that information gathering phase, there, if it's someone who has been in the work industry, has had the 401ks and the financial, all the things done for them through an HR
Mhm.
department for their entire life, they're going to have to talk to someone, because you don't want to lose all of those benefits that you've been accumulating. So,
Yeah.
when you start having those financial conversations with your rollovers, when you need to know how much it's going to cost in order to insure yourself, that's when you need to give me a call.
Yeah.
In order to enroll, it takes about a week and a half for
Okay.
private plans, and or it generally, things will start at the beginning of each month.
Okay.
So,
That's good to know the time frame of how long it takes, because if some people are
right.
starting to plan out their exit, they want to know when they need to have it in place. So that's great.
And you know what? Taking that first step is sometimes, and I've learned this from working with someone such as yourself, Malika. You've been one of those, let's just eat the frog. But sometimes that step in getting your health insurance under control really leads to some other things that need to be taken care of, and
Mm.
set yourself up for success if you should make those changes.
Yeah, that makes sense. So if someone's considering, leaving their regular career to become an entrepreneur, you might be one of their first calls,
Yeah,
because once they can figure that out and they know like, oh, it's possible I can support myself and have life or have health insurance and take care of my family, especially making sure their family is able to be covered with their, health insurance plan and things like that. So it
right.
sounds like you should definitely be one of their first calls.
Well, especially if they have children, because
Mhm.
adults, kids are the ones who we need to be insured. If you've got a family and they're under a group plan, you got to make sure the kids are insured. So,
Mhm.
um, and not everybody has to be on the same insurance as well.
Okay.
That's the other thing to keep in mind. I mean, even within a family. So, I bring that creative. We get creative when it comes to insuring, because sometimes we have to. Um,
Yeah.
and situations change on the regular, so we have to keep up with it as well. We just need to be prepared for those things that we did not expect to happen. That's what
Yeah, and I
insurance
think
is for.
I think that what you just brought up is something that no one would usually ever think about. We would think like if we're putting myself on a plan, my husband on the plan, our children have to be in that same plan. So I love that you bring that creative thinking of like, well, we
Mhm.
can structure this a different way to make it work best for you.
Right.
And you have that knowledge that we wouldn't know just looking on our own. That's
Well,
awesome.
there are a lot of, if you are going on your own, and starting your own business, the way that your business is set up and the way that you've set up, let's say your salary or what your reportable income is going to also make a big difference in what your insurance is going to cost as well.
Mm-hmm.
So, it is strange how that health insurance does kind of creep into so many different aspects of our planning. But
Yeah.
yeah. So yeah.
All right. So is there times where you're contacted by someone that isn't the right fit for you? And what does that look like?
So that's actually why I stopped becoming, I stopped, yeah, I went from a captive agent to a broker, was because I was
Okay.
turning away so much business, because
Oh,
I
okay.
can't fit everybody into a small, to one type of plan. Um, that said, those that I'm unable to help generally are Medicaid and like Peach Care for kids, and the state plans like that,
Okay.
like Medicaid and Medicare Advantage. I don't enroll in Medicare either, but I do have Medicare supplements, which is different than Medicare Advantage.
Okay.
That those require different certifications, and I have awesome relationships with those that do help people with those situations. So
Okay.
that's
So if
what I love
someone's
about being a
unsure, they
broker.
should still contact you maybe, then you can help guide them.
Yes,
Yeah.
because I will get them to the right next person.
Yeah.
I don't. I can't, in good faith, just say can't help you. Got to go by. So that is,
Right.
I don't mind having those conversations at all.
I love that.
Yeah.
What happens if somebody is hurt or sick? Like, let's say they're uninsured, they're hurt or sick. Is it then too late to get the health insurance? If they're already going through some type of medical issue, can they call during that medical issue and say, like, this is happening, I need insurance?
It's possible to get insurance, but probably not for what you're needing it for at that moment. So
Mhm.
that particular moment is done.
Okay.
At that point, there are some resources out there to help advocate, and we can work with the hospital systems or whoever is, whoever the provider is. We can work with them and try to negotiate some costs down.
Okay.
But if you don't buy insurance when you need it, you buy it when you don't need
Right.
it. And
Yeah.
and it's not even about insuring you. It's ensuring that your financial stability is not, you know, weak if something should happen for your
Mhm.
survivors or the people who are depending on you. It's a financial
Yes.
plan. It falls into financial planning because
Mhm.
it's not to cover a doctor visit because you have the sniffles. It's to make sure that you can have rehab if you're in a major accident or you have a major
Mhm.
illness. So, um, though there's a lot of, well, I'm fine, I don't need insurance.
Right.
It's, well, you may not, but the universe might think that you do at some point, and someone's gonna have to pay for it. And so it's just it's a fiscal responsibility.
Yeah. And I notice I end up having a lot of clients, and I don't necessarily know if they have insurance or not, but medical debt is a huge issue in this country. And so if you don't have insurance, you're going to get bogged down with a lot more medical debt. And that's going to completely derail your path to trying to build wealth, your path to paying off debt, all those things. So it's so important and so crucial. That's why I'm
Right.
glad like you were able to talk to me today, because I feel like this is really important, that people need to know the importance of insurance, and that there's people out there. Like before I met you, I didn't know that there were even people that could support you in figuring out your health insurance. So this is exciting. I hope other people are listening and realize that this is a great support. So question for someone that does come to find you: do they have to pay out of pocket for your services, or is it covered through the health insurance companies? How does that work? So someone's coming to you and they're like, oh, I don't have the money to pay you, or how does that work?
So I'm a what they consider commission only. So I get paid when I produce, so to speak. But that doesn't, I don't even know what my commission schedules are, because whatever you need, that's what that's what I'm going to put you on. So I don't care
Mhm.
what I make off of it. Now, is that fiscally responsible on my end? Maybe not. But I'm working with someone who might be able to help me get to that point where I can. And I think eventually, when it comes to like small businesses and more of if I'm creating a benefit package and like an employment or employee package, there may be some fees that I might add an application fee or something like that.
Mhm.
But for right now, there is no cost other than the cost of the premium. And
Right. So if they're coming to you, they don't have to pay an out-of-pocket cost
there's not an
necessarily,
out of
especially if it's just a single person, entrepreneur. They're not like a business looking for for their staff. So I think that's important for people to know, that
yeah.
that's not a barrier. That should not be the fear of making that call. If they're thinking like, oh, I'm sure she's going to charge me an arm and a leg just to set up my plan. Like that's not the case.
It's funny because I never thought that that may be something that someone would even be worried about, because I've never
Hmm.
charged that fee before. So
Yeah.
anyway,
Yeah,
interesting.
no, that's awesome. All right, I have a couple like fun questions mixed in
All right.
here. So, what type of music do you listen to?
Okay, as a Gemini, I am all over the place.
All
So
right.
it just depends on what my mood is. I have playlists. So I guess if I had to narrow it down, I love like Harry Connick Jr. I love to
Oh,
whatever I can
okay.
sing along to. I love to sing.
Yeah.
So but or I don't know. Let's see. If I had a genre, probably 70s light rock, like Air
Okay.
Supply and that kind of stuff.
All
And
right.
yeah, that would be my genre.
Okay. Awesome. What about favorite movies? And I hate this question because I'm never good at like narrowing it down. So it doesn't have to be like your all-time top, but just like some movies that you like that you're in.
So for a very, very long time, Pretty in Pink was one of
Okay.
my favorite movies. I mean, I
Yeah.
just, ugh. But within the last 4 years or so, Spider-Man Into the Spider-Verse has been the
Oh,
most
okay.
influential movie in my world.
All
And
right.
I love the message. I love the art. I love the music. I love the the everything. It is such a, when the chips are down, you just get back up, and that's what separates us from everyone else, is we get back up. You get knocked down, you get back up.
Mm-hmm.
And
Mm-hmm.
that kind of attitude is so important, especially as an entrepreneur,
Yeah.
as a mom, as a fiance, as a friend. I mean, things as just as a human in this world right now, things
Mm-hmm.
happen, and you just got to get back up. You cannot lay down and take it and
I love
just
that.
give up. So, yeah,
I love that.
that's
I haven't seen it, so now I feel like I'm gonna have to go see the movie.
oh, and your kids,
Yeah. Okay.
it's so good. So, and
Okay.
it's just
Awesome.
visually, it's amazing. So,
I
anyway,
will definitely check it out. All right. So another question for you about business. Now we'll get back on the topic. Have you had a situation where a client came to you and you were really able to help them, like it kind of pulled at your heartstrings, but maybe they were in some type of, I don't know, negative situation or stressed about a situation, and they started working with you and you helped them figure it out?
yes.
Mhm.
And that actually happened over open enrollment this past year. I
Mhm.
spoke with someone whose daughter was having some problems with drug or substance abuse. There
Mhm.
was a lot of that she needed rehab, but she had no job. She had not been able to, she got declined on Medicaid. She can't afford, she needs, all these different services. Anyway, long
Mhm.
story short, I was able to find a plan that allowed her to get enrolled into a program. And I got her special open or special enrollment period. So even outside of enrollment, she was able to get enrolled.
Mhm.
And then when open enrollment came through, we were able to roll that plan into the next year. So she still
Mhm.
has that coverage. And the mom was just beside herself. The first call was, "You're not going to be able to help me, but my friend Laura, who's known you since your daughters were in 2-year-old preschool." Okay, that's how old this referral came from. But she said, "You're not going to be able to help because no one has." And
Oh,
but
wow.
I thought I'd call and give it a shot.
Yeah.
And here we are. And that meant so much to me that I was able to help her get
Yeah.
to her daughter and her daughter to the right path. And it was one of those, this is why I do this moment. And I love it. So
That's
I
beautiful.
always,
That's really life-saving. Like you helped to possibly save this young girl's life, like
right.
because of now she's able to get the help that she needs. So I'm so glad you told that story. That's amazing.
Yeah.
Yeah. I
It
love
was one of those that just, yes,
Okay.
one of my
All right.
moms.
And you mentioned open enrollment. So I definitely want to take a few minutes. Can you explain what that means? Is there a certain time period where you're only able to get people enrolled? Can they not call at different time periods? Can you talk a little bit about that?
So depending on what kind of coverage what someone needs and what's going on in their world, whether they've had a life-changing event, like got married, they moved, pregnant, lost a job, lost their current coverage. Um, any of these things will qualify you for what's called a special enrollment, which is outside of that November 1st to, well, they keep increasing the enrollment period, but it's generally the end of the year when there's anybody can apply for coverage no matter what your situation.
Okay.
So that's just for marketplace plans, and that's what the Obamacare, the exchange, there's all different kinds of names, but it's the plans that are available in your area
Mhm.
through their government plans is what they are. Um, and then if you want to look at private coverage, there are private coverage. You have to be underwritten, which means you have to qualify both financially and physically for that
Oh,
kind of
okay.
coverage. But there are no enrollment periods for that type of coverage. So if you
Oh,
fall
okay.
outside of enrollment period and you couldn't quite get all your stuff together in time to get in that special enrollment, then and those are a lot of times considered like short-term plans, or
Oh, okay.
you
Could
can
they
get
kind of hold you over until the next enrollment period?
right.
Okay.
But there's also private plans that are available that are much less expensive than marketplace plans if you do not qualify for those tax credits that they're
Okay.
giving right now. And I will tell you, there is going to be a huge shift in these tax credits within the next 4 to 8 years. I mean,
Mhm.
I would say even before that, but think what goes up must come down, and
Yeah.
we're going to have to this money that we're given to everybody is going to have to get paid back somehow.
Mhm.
So these rates that people are getting, good rates through marketplace right now
Will
because,
change.
but if you're more successful and your income goes up, then your marketplace rates go up because you've lost that tax credit. So
Mhm.
when shopping for insurance, it's important to understand where you are right now and where you are and where you may be in about a year.
Oh,
Each year
okay.
we can look at this and we can reevaluate. But
Right.
if I'm hoping to be in a place where my income's going to go up and my premiums are going to go up.
Mhm.
On some level, I'm okay with that, but I may at some point have to look for a different plan. But that's why they have different plans. They're different.
Right.
We this when you buy a new car, you have to get new insurance for that car. So there's just different things um,
Right.
for
Okay.
different parts in our in our world.
All right. No, that's good to know. Can you talk to me about what states are you able to work in? I know you said that they're kind of government plans. Are you allowed to do certain states? How does that work?
Yes. So I am licensed in pretty much anything that touches Georgia's, except
Okay.
for Florida. So South Carolina, of course, Georgia, South Carolina, North Carolina, Tennessee, Alabama, Texas, Michigan,
Okay.
and Ohio, and North Carolina. I don't know if I said North Carolina.
Okay.
But those are the states that I am licensed in. I
Mhm.
have a partner who's licensed in about 15 more states. So she is we are hoping to be able to help even more people now.
Yeah,
Um,
that's awesome.
like I could get licensed for all that, but I don't want to. Let's let someone
Right.
else have all that fun. So
Yeah.
yeah.
No, that's perfect. All right. Is there anything else like about your business that you feel like is that you do that you really want people to be aware of that they can come for you for?
It's more than just health insurance,
Okay.
and we have conversations that turn into I hear other pains and I hear other needs, and I'm not going to just come in and tell you how to do everything and you should talk to everybody. But if I hear you say something and you've mentioned it maybe 3 or 4 times, I'm
Mhm.
going to say I'm going to bring up a contact that I may have that could be of help for that
Yeah.
situation. So I have
Awesome.
become a trusted resource with a lot of my clients as well, and vice versa. I mean, these relationships have taken me to all kinds of new places. So it's been a nice ride.
I love that. You're kinda like a one-stop, like, even if you don't do it yourself, you can point them in the right direction of where they need to go,
It's good to know
and
that
I'm
you
sure
have
they
a
leave.
plan.
Yes, I'm sure they leave so much more, like, relieved of like, "Okay, now I know where to go because they talked to the chick with the plan." I love this. Alright, so can you tell people watching how they can find you, contact you, and get in touch with you?
So I do have a local office here in Kennesaw at 3745 Cherokee Street, Suite 101. And so please come and stop by. I'd love to see everyone. And we also have a Decatur office. So we don't have a street location for that quite yet, but we just have a broker who's over there and working with the community.
Mhm.
But you can also reach us to schedule an appointment by visiting www.diamondchickconsulting.com and register or make an appointment with either myself or with Samantha, who is my new partner, and take it from there.
All right, awesome. Thank you so much, Stephanie. Like, I feel like I
Thank
learned a
you.
lot, and I'm excited to talk to you because at some point, we want to go, me and my husband want to go full-time entrepreneurship. So we're definitely going to need to figure out what that looks like
Awesome.
in terms of health insurance. So now I'm just realizing, like, yeah, like we need to have more conversations for sure. But again, thank you so much for joining us.
Thank
Anyone
you
that's
for
watching,
having
I really appreciate you watching today. We will do money plan conversations each month. So once a month, I'll be bringing on somebody else to provide you with information on whatever topic could help you financially so that you can work on taking control of your financial story. All right, that's it for today, and I'll see you next month.
Thanks,
Bye.
Malika.